Hello everyone, I'm going to talk about flaps. The points you see in front of you were taken from the MCQ books that you have read, and all of them came in form of MCQ. Here you will find the type of flap with its vascular supply, or with its advantage or disadvantage, or something special to this type of flap. We start with the paramedian forehead flap. The notes here is flap vasculature is more superficial in cephalic portion of the flap. The most common cause of free flap failure it is venous clot. What is the primary blood supply of cervical-facial advancement flap? Facial artery. You can memorize it facial, the word facial, so it is facial artery. The best flap for through and through defect of the nasal area is folded for paramedian forehead flap. What is the blood supply of lateral nasal wall flap? The inferior meatal branch of inferior turbinate artery. What is the blood supply of submental flap? Also facial artery. Till now we have two flaps supplied by facial arteries, cervical facial advancement flap and submental flap. The radial forearm free flap is favorable. Why it is favorable? Because of long variable vascular pedicle able to reach the cervical vessels. The most suitable regional flap for patient underwent multiple surgeries and chemoradiotherapy is supravascular flap. Flap donor site provides soft tissue only without the option of osteocutaneous flap. It is the anterior lateral type. The drawback of temporoparietal flap, one of its drawbacks is the potential alopecia. The survival of axial flap correlate with the length of axial vessels. Regarding submental island flap, as we said, it's blood supply from facial artery, specifically the submental branch of the facial artery. Memorize this submental island flap, submental branch of facial artery. It's easy to memorize. Regarding total glossectomy, we either use the radial forearm free flap or anterolateral thigh. I have some points to mention about total glossectomy. In Byron Bailey, there is MCQ and they choose rectus abdominis. And in Myers operative, the radial forearm flap, they mentioned that it should be avoided in reconstructing total glossectomy defect. So pay attention and read the options provided in your question and answer accordingly. Regarding vulva flap, what type of flap? It is a type of random flap. Regarding blood supply of trapezius flap is occipital, transverse cervical, and dorsal scapular. The hinge flap is septal mucosal flap is hinge flap. The bilobed flap, blood supply is based on subepidermal plexus. The disadvantage is scar complexity. Paramedian forehead flap is a type of interpolation flap. Millard operation, rotation advancement flap. The vascular pattern of trapezius is type 2 and pectoralis major and maximus dorsi type 5. The rhomboid flaps, type of transposition flap, Mobius syndrome, we use for reconstruction temporalis muscle sling. The benefit of premaxillary graft is increasing tip projection. Regarding fibula flap, the length taken should be 25 centimeters and is used for reconstructing anterior mandibular defect. Regarding scapular free flap, is used for lateral mandibular defect. 10 to 14 centimeters can be harvested from its lateral border, so you can memorize them by comparing them to each other. The fibula for anterior mandibular defect, the scapula for lateral mandibular defect. The length, the numbers 25 centimeter and 10 to 14 centimeter may come in MCQ, so pay attention to these numbers. Regarding nasal air layer, can be reconstructed using the nasolabial flap, nasal tip, paramedian forehead flap. Nasal air, we say nasal air, nasolabial flap. And if you remember, I mentioned paramedian forehead flap. So the main flap for reconstructing the nasal area is nasolabial flap. And in certain cases, such as through and through defect, we can use paramedian forehead flap. So pay attention to this point. The radius can be taken for reconstruction. 40% of its circumference can be taken, and the length of the segment will be 10 centimeter length. The most versatile of the local flaps available for nasal epithelial repair are the transposition flaps. The best speech and swallowing results can be obtained by using anterolateral flap. I finished the notes, and in addition to these notes, to cover the subject of the flaps completely, fully cover the subject, you can go back to chapter plastic and reconstructive surgery in Jatinsha, chapter 84 in Cummings 4th edition, and chapter 163 164 in Byron. I hope that everything is understandable. Thank you very much.